Welcome back. As the Kent County Community Mental Health Authority, Network 180 serves adults, children, and families who need assistance with mental health, substance abuse use, and intellectual or developmental disabilities. Now, this is a vital resource for thousands living in the area, and today we welcome Executive Director Bill Ward to the mix to learn about Network 180, how it's expanding its reach. Good morning, Bill.
Good morning. Thanks for having me here today.
Absolutely our pleasure. Talk a little bit about the Network 180's overview, just an overview of what you guys do in the community.
Yeah, so as you said earlier, Network 180 is Kent County's mental health authority. We serve about 15,000 individuals a year, and we do that through a hybrid of a small number of contracted services by Network 180 directly at our Fuller campus on the county campus. And then we have about 100 contracted providers throughout the county serving all the populations that you talked about earlier.
It's interesting, 15,000, maybe a larger number than many might have realized. And it's true, you truly are a network, a great resource of all of these different options that people have for getting help. And there's some new options now available, right?
Yeah, we were really lucky. Last May, we were awarded a certified behavioral health center through the federal government, which is a $2 million grant, which allows us to expand services to pretty much anyone. The challenge that Network 180 always has is that we are the public option, and sometimes individuals that have, private insurance or who are what's called mild to moderate will come through our doors, and then we have to turn them away. Because of the CCBHC, we don't have to do that. And what that allows us to do is to provide some preventative services or some therapy or some coaching prior to a crisis. Because if an individual lands in crisis, then they do become Network 180's responsibility to make sure that we keep those individuals safe. So because of that, we've actually allowed us to reduce our costs on crisis services from $12,000 an episode down to about $3,000. So it's really had a major impact just in the 9 months. We're really excited that the grant was renewed this year, and we are hopeful that that grant will become permanent for a long term. So we really can be the no wrong door for our entire county.
That's amazing to be able to cut the cost that much, almost 75%. But mobile crisis, this is something that you offer. How does that help people?
Well, this is something I'm really passionate about. This is being able to go to an individual who is in crisis at that time, instead of having to bring them to an emergency room or walking into our access center. It's really going to serve the individual and hopefully allow that crisis intervention to be made immediately on the spot, whether it's in their home, whether it's at their school, whether it's just on the street. Previous to us getting the CCBHC, we were doing this for children and adults, or children and families going to their home or going to their school. Because of the CCBHC, we've been able to expand that to adults now. So we, and it's a small team. We only have one. We would like to get more, but we're able to provide that service in person now. We're also looking at expanding that to do co-responses with law enforcement. So we've begun to start piloting that as well. It really is additional tools in the toolbox to prevent crises that are happening in our community.
Very cool. You can meet them where they are with that mobile crisis unit. Now, so let's talk about two things that people are probably wondering if they're seeing this. Substance abuse, they may know someone, mental issues. So let's talk about, how do we get in? Are there age restrictions? How much income restrictions to receive these services? What are the criteria?
Well, because we've had these expanded grants now, there is no age or income restrictions. So if you have private insurance, if you have employer-sponsored insurance, if you have Medicare and Medicaid, we can serve anyone. And if you have no insurance, we have plans for that as well. So we really are trying to be that community resource for everyone. And again, I thank you for having us on, because May is Mental Health Month, so we really want to make sure that we promote these services that we have for our community, especially as we are returning to normalcy from the pandemic. We really want to be that resource out there for the community.
Bill, thank you so much for the time this morning. Executive Director Bill Ward from Network 180. Great information. If you want to contact them, pretty simple. They're open 24 hours a day, 7 days a week, every day of the year. And as you heard Bill say, they've expanded their services, insured, uninsured, they can help you. So if you need help with that substance abuse or mental health issues that you or someone you know suffering from, contact Network 180 by calling 616-336-3909. That's 336-3909.